The Australian Medical Association is paying a visit to the Sth East today, with the New South Wales President, Dr Danielle McMullen, stopping in at the Sth East Regional Hospital in Bega this morning, and then talking about the new Eurobodalla Hospital and heading to the new site this afternoon. Dr Danielle McMullen, President of the New South Wales Australian Medical Association, joins us this morning. Hello.
Good morning. Thanks for having me.
Thank you so much for coming by. So the vaccine rollout, it's happening in GP clinics. What are you hearing from GPs about how it's going, particularly in regional New South Wales?
Yeah, it's been a real challenge across the state. I'm a GP in my day job, and yes, I'm Metro. But even for us, it's been a nightmare. And we have heard that it's been similar around here. Phones ringing off the hook, GPs being really overwhelmed with calls, and in some situations, phone systems going down. And all for vaccines that are not yet here. So some bit of patience from the community would be great. There is going to be a dose for everyone, but unfortunately this rollout is a slow trickle rather than a flood of vaccines, and apologies for my poor choice of words this week.
But looking at the website of one local medical clinic, they're saying at this stage they've been allocated 100 vaccines per week, which I'm guessing isn't going to meet all of the demand. So how are clinics managing this?
There are a few clinics who've been given bigger volumes of doses. But many of us have only got 50 to 100 a week, which is an afternoon or a day of vaccinating. It's not that many doses. We're hopeful that numbers will rise as we see the production coming out of that CSL factory, and we're getting locally made AstraZeneca. We should get some more doses, but we've really got to kind of keep pressure on government to get doses out as quickly as we can, but also be patient in the meantime. Practices will be trying to pick out their most vulnerable patients, and a lot of us are in a don't call us, we'll call you phase, to try and make sure that we're getting to people as quickly as we can without compromising other healthcare.
Is there a better way to do it, do you reckon? Should it all be, everyone in town head to the town hall and you get an appointment or designated one afternoon a week or something like that?
Look, that potentially works for young, well people, but we know that elderly, frail people with other health conditions, the safest place for them to have their vaccine is with their usual GP, if at all possible, because we know, your GP knows your health conditions, and people feel comfortable getting there. We know they can get in and out of the place. So there's good reasons to have, particularly that group that we're vaccinating at the moment, have it be done in general practice. We just got to get that rolling out a bit quicker than it is at the moment.
All right. Now, speaking of feeling comfortable, how comfortable are you with the announcement yesterday from the state government that as of Monday, COVID-19 restrictions on singing, dancing and large gatherings will be lifted?
We knew it was coming, but I still felt shocked. I was just talking to a friend the other day and we were, commenting on Victoria allowing 75% of the MCG, and here we are at 100. So I think we've got to remember that the pandemic's not over. We are living, particularly in the regions I've noticed, living like COVID doesn't exist, because there hasn't been much of it, which is great. But if it creeps in, if it got into a regional area, your health systems would be so quickly overwhelmed that it is really important to still maintain that physical distancing, keep washing your hands, and of course, if you're at all unwell, go and get a test, stay home from work. It's not over yet. I feel like a bit of a broken record after a year, but
are you worried? I mean, we've been so well behaved, and it's a big part of the reason why we've done so well in New South Wales. Are you worried that if people get too much of our freedoms back, it's going to be hard to put the genie back in the bottle?
Australians have responded really well to the public health directives, and particularly in New South Wales, our community has been fantastic. So I'm hopeful that if there was, that we're watching those quarantine centres closely, we're looking for cases. So as long as if we keep looking for cases, we pick one up and we all retreat back to our more restricted lives, we can hopefully make it work, but I am a bit nervous.
Okay, yes, I think a lot of people share the nerves you have about that. Now, the Australian Medical Association Rural Health branch made a submission to that inquiry into rural health on Friday. With that inquiry has already heard, I guess, lots of pretty scary stories about what goes on in regional and rural health. What are you hearing from our region about how that applies and what some of the issues are here?
Yeah, the reason we're down here this week really is to learn from the community, learn from the health community, because the South Coast, everyone thinks of this area as a wonderful place to have a holiday, but from an infrastructure point of view, you're so isolated. And we know that it's a long way to anywhere from anywhere, and really you need high quality health services. And you've got a brilliant, fancy big new hospital here in Bega and a really passionate group of doctors, but we're here to try and understand how we can boost that more. What support do your health workers need here to keep them here and to be able to deliver the best quality care? And then up the road, you've also got a new hospital on the way at Eurobodalla, and so we're planning to visit there as well and just learn what it is. A building is one thing, but we need to make sure that the resourcing is there to support the doctors and other healthcare workers to be able to deliver care to the community.
For you, is there really a noticeable difference visiting a city hospital and seeing how many of the staff and doctors are, full-time, permanent, and then going to a region and seeing a greater reliance on, say, locums and fly-in, fly-out workers?
Yeah, certainly you need, for a community to revolve around its hospital, as so many do, you do need that permanent staff to build the culture, to build the teaching and learning environment, to sort of understand the community and its needs. So there's a huge importance on the very few doctors, nurses and others that you have here that are permanent here. And I think we do need to reduce our reliance on locums and the fly-in, fly-out who aren't as invested in the local area.
Okay, so the big development in our region is the new Eurobodalla Hospital. What are you pushing for or hoping for when it comes to the level of services that hospital will provide?
Yeah, so we're here to hear from locals this week and don't want to speak for them without listening first, but it's about making sure that there is not just the money for the bricks and mortar, but the money for the staffing and the resourcing as well, because we don't want to see, we know there's been some issues here, some people feeling like even at the Bega Hospital there's maybe not enough resourcing to just get simple administrative tasks done, and that can't be the case in the new place as well. So we've got to make sure that there's enough money to actually staff these and have them running smooth, efficient operations so that care can be delivered by the right person to the right patient.
And I know this is something that you'll be hearing more about in your travels today, but do you think there's a good case for the Eurobodalla Hospital to be a level 4 hospital like Bega and Goulburn?
Yes, I think they're under pretty advanced negotiations about the intricacies of level 3, level 4, and it does depend on which services exist there. They're certainly putting forward a good case as to why they do need that more critical care infrastructure. I think we've got to take a whole of network district view of it. So long as the patients of the region can get the care they need in a timely way, that's our biggest aim. So if that means that Eurobodalla needs to be level 4, or if it means that we need to boost up Bega, we've just got to make sure that patients are getting the right care.
All right, well, good luck on the roads today. You might still come across a bit of debris here and there. Also, I guess we should talk about the impact of multiple natural disasters, I guess, on the psyche and mental health.
You guys have been smashed down here, drought affected, bushfires, floods. It's the community has been through a lot. That obviously has impacts on a whole lot of things, but particularly mental health. And certainly that's one of the things we're hearing here is that you really do need more mental health support and facilities and staffing and doctors and psychologists and really that infrastructure to help support that aspect of healthcare too, and we can't forget that.
Yeah, it's going to be interesting to talk to you after you've spent more time on the ground here. But Dr Danielle McMullen, really nice to meet you. Thank you very much for coming into the ABC South East studio.
Thanks for having me.
And great to have you in the region asking these questions.